I'm Jody Sindler. I'm a professor in the School of Public Health. My PhD is in economics, so I do health economics, applying economics to health, and more specifically my area is the economics of substance abuse and different addictions. And I look at addictions broadly. It could be anything from smoking, smoking, illicit drug use, alcohol, particularly alcohol misuse, drunk driving, all the kinds of things that you think of like that. But of course, food is increasingly being seen as an addiction, particularly addiction to sugar, high sugar, and high fat. So, interestingly for me also, I've done a lot on tobacco, and the issues that occurred with the tobacco companies are now being applied as a good template to food. So, for example, the tobacco companies are really pretty bad in the sense that they have lied to the government about they increase the amount of nicotine in tobacco to try and get people hooked. They try to get youths using tobacco by, used to use, until it was banned, they would use cartoons like Joe Camel. They would advertise at the kinds of events that youths would go to, because so many people are quitting that if they don't have youths coming in, they're going to have nobody left. And they're actually worried with all the smoking bans. And so an interesting thing about tobacco companies, too, they're going now to sell in China and internationally because they know in the United States it's drying up due to all the regulations.
Yeah. So is the food industry doing the same thing?
So the food industry, there are some things like that. Putting in more sugar than necessary, putting in the wrong kinds of fats, and then defending themselves in different ways, saying that, or the idea of selling different kinds of snacks to youths, or advertising sugary foods on TV programs, on cartoons on Saturday. So that's somewhat of the background for the kinds of things I'm interested in. And I actually teach a course on this as well for both undergraduates and master's students. It's called the Economics of Addiction and Policy. So we go over food addiction, alcohol, issues like how do you stop drunk driving, alcohol abuse, overuse of or misuse of alcohol in colleges. I have my broad areas, the behavioral economics, which is combining psychology and economics, and applying that to substance abuse.
So how do you combine psychology and economics?
Well, I'll tell you, so it's called behavioral economics. It's a pretty fast-growing area right now. And in neoclassical economics, we figure people are rational, they make their decision, they figure out what's the optimal amount to consume, and they consume that. When behavioral economics says, well, there are other things that affect your decision. It's not that you're superhuman. You are rational, more or less. A famous example, it shows that different decision biases and how people make decisions. But one of the ones that I think is interesting is self-control. So in economics, when you've optimized on the margin, it's better to consume this or not, you make your decision and you say, then you're going to do it. You've decided, so you do it. With self-control, it says, well, you've decided you're going to go on a diet. But when's the optimal time to start the diet? Everybody knows it's tomorrow. Tomorrow never comes, so you never start. So it just really compares making a decision. You've done the calculation, you know you're better off losing weight, and you don't do it because we call it a present bias. You're so oriented to the present that you always put it off. And there's some kind of time inconsistency, we call it too. Inconsistency is saying people don't discount in the way that we thought they do, at least with particular kinds of things. And the kinds of things that I'm talking about right now are those where there's a temptation. You have to learn to resist temptation. And that's the only time self-control is needed. So you don't really need to resist temptation if you say, I need to buy a school book. You don't have this internal fight. I'd rather put it off to tomorrow. You just need the book, you buy it, and you've made your decision. There's no self-control, or very little. But on some things like foods, any kind of addiction, nicotine, illicit drugs, there is the desire to be of sort of two minds of this. One is you want to quit, and the other one is you want to consume. So these two minds can be described as the root of addiction, that you want to quit, but you don't want to quit. So which one wins out? And that's partly why small payments might be able to change the balance. You really want to quit, but now someone's offering you, but you put it off till tomorrow, but somebody's offering you a small amount of money or some prize or some reason to do it now. So you have people on the balance, they say, okay, you've just changed my decision, I'm doing it now. So this whole idea of bias, self-control bias, being on the balance, being time inconsistent, meaning you want to be on the diet until the time comes. You want to be on the diet if it's a month from now, but when the day comes that you're supposed to be on the diet, you prefer it in a month to now. So this interest in behavioral economics, and there's a whole bunch of interesting things on that, got me interested in the whole idea of self-control and willpower, which is clearly operating in addiction. We could say that people always want to, most people, 70% of the smokers want to quit, so they want to resist their temptation, but they can't because of low willpower or self-control. So through that, I worked with a number of people in medical school on a big grant on self-control, stress, and addiction. And the underlying concept there is that self-control matters in addiction because you want to quit, but you never have the self-control to do it. But that stress actually makes life worse because it reduces your self-control. Your brain is being taxed by stress. For example, if you're bothered at work or you're under stress at school, you might be more likely to eat the cake that you didn't plan to eat, or drink the alcohol that you hadn't planned to drink, because your brain is sort of calculated, dealing with the stress and not exercising self-control. Then you get home, your self-control, because it's a depletable resource, is gone. Then you consume the cake that you hadn't planned to eat, or you had a gallon of ice cream and now your self-control is gone and you eat that, or you smoke the cigarette, whatever. So working with this group, I got much more interested in self-control as an issue and stress. So my view on this is that there are a lot of psychologists who look at self-control, and behavioral economics is getting to be a really hot area. And so one of the areas that I took it is into looking at how tobacco taxation affects smoking. And there's a lot of evidence that the higher the tax rate, the less people smoke. But I was interested in whether there's what we call heterogeneity, different groups, and if self-control, the question was, how does self-control affect the policy of having a higher tax rate? And the hypothesis could go either way. If you have low self-control and they increase the tax rate, you might say that that is sort of an external mechanism that helps you quit. And that's the idea, that the tax rate is inescapable. If it's a higher price, you're going to respond to the price and smoke less. And that's the overall effect, is people do smoke less. But I was interested in how does self-control affect that differentially. So if you have high self-control, it may mean that as the tax rate goes up, you could go either way. You could respond to it because you recognize the price, so then you say, I'm going to cut back even more. On the other hand, you could say, well, it's a high price, but I've already decided what I want, and I can enact what I want. I'm not going to let that price affect me very much. So we looked at heterogeneity in how taxes affect different people. Particularly in tobacco, there's a big difference between youths and older people, because most people start smoking under age 18. So the big concern is making sure that people don't start smoking, because once they start, they're pretty much addicted. What we wanted to know is, do people with different degrees of self-control respond differently to the taxes? And so what we looked for were two things. One is this: compare what if you just looked at what the response rate to the tax is for the whole population versus what is it if you could separate out these two different groups. And we found that there's a statistically significant difference in the response to taxes across these groups. So one group, the larger group, is less responsive than our smaller group. Most people who had lower self-control we're more likely to be in our group that's more responsive to the tax. So what we find is those who have low self-control are more responsive to the tax. As I said in advance, it could have gone either way. It's an empirical issue. There's a theory that the more self-control you have, the less responsive, or the more self-control you have, the more responsive. You can go either way. So you don't really know a priori by theory. You have to find empirically. And we found that in the case of youth tobacco smoking, those people who have higher self-control, lower self-control are more responsive. Tobacco taxes are a powerful tool to help people quit smoking because the higher price makes you cut back. But if the people who have low self-control are not responsive, then you have a group that is just paying higher taxes and not changing their behavior. And they also might be the people that you're more worried about with other ways as well, because with lower self-control you're going to have lower savings rate. We might think lower self-control would mean you're less likely to have higher education. So there might be a disadvantaged groups in other ways. So the concern is if you're taxing people who are going to just keep smoking anyhow, and they will just be harmed by this. And so although it might make sense on an overall, on average, it may not be good for different groups, and the more disadvantaged group may be treated worse.